ASAM's core purpose is to improve the care and treatment of people with the disease of addiction and advance the practice of addiction medicine.
Most people know addiction actually by the behaviors that people have when they have addiction. People often do things that aren't considered esteemable or very positive pro-social behaviors when their addiction is active. In fact, they can have a lot of problems in their lives and cause trouble in their family, trouble in their workplace or their other pursuits. So much so that some people understand addiction as a behavior disorder. The leaders of ASAM are physicians who practice addiction medicine, teach and do research, but most are actually not researchers. And they've listened to and read the work of research over the last 20 years, and we've understood that addiction really is a brain disease. And the thing that distinguishes a person who has addiction from a person who doesn't have addiction is how their brains function when they're exposed to rewards such as drugs and alcohol. So looking at addiction only as the behavioral manifestations actually misses the point of where did those behaviors come from. So this project was an effort to try to pull together what's been learned through neuroscience research and put it in a format that the average member of ASAM, even maybe more importantly, the average patient who we treat, or the average public policymaker who develops national policies regarding addiction, could understand what is known to the scientists.
Addiction specialists differ from other doctors in that they are trained specifically in the field of addictive disease. Now, some people think to themselves, well, addictive disease is just a branch of psychiatry or just a branch of medicine, and therefore any doctor who specializes in medicine or who specializes in psychiatry will have knowledge of addiction. And that's true to an extent, just as it's true that if you have mild hypertension, you can go to your primary care doctor and receive perfectly appropriate care. If you have the next level up of hypertension, it's not mild anymore, well, let's call it moderate. You can see your family physician, a physician board certified in family medicine, or an internist, board certified in internal medicine, and receive the best treatment. But if you have severe hypertension that's not responsive in the usual ways, you want to see a hypertension expert. Well, if you have addictive disease that's not responsive in the typical manner, where the physician interacted with you and had a brief intervention and discussed the issues with you, or sent you to an AA meeting or an NA meeting and then asked you a few weeks later, how did that work for you? Were you able to stop using? If the patient says no, or if the urine drug screen shows no, well, then they need something more than the type of care that would be offered to somebody with a low level of the disease state. That's what the addiction specialists are here for. The American Society of Addiction Medicine speaks frequently to the topic of addiction in both state legislative bodies and in the federal environment. We have done a great deal of work in terms of public policy, in terms of legislative efforts, in terms of creating relationships where relationships didn't exist before, to be certain that those who are in positions to change the rules, change the laws, can do so in an educated manner. At the same time, we need to make sure that the general public is aware of what addiction physicians can do and what our specialty is and how we can help them. And at the same time, we need to make sure that the entire field of medicine is aware so that the referrals come to us when it's appropriate for them to come to us.